Hey, I'm Cash.
Hey Kesh, nice to meet you, man. Lawson.
Yeah.
Let's take a seat here if you.
Cool, thanks, yeah.
Yeah, how's your day been today?
Yeah, really good, man, yeah.
Yeah, great, yeah. Okay, man, well, now that we've got you in here, what we're going to do is just run you through a basic pre-exercise health screening. And really what it is a health and risk assessment, just to give us an idea of where you're at physically, medically, mentally, all those things, see if there's anything we should be aware of. And if there's any further consultation that might be necessary, you know, just any things like that, and it'll really help us in the long run getting an idea to give you an individualized program.
Yeah.
Yeah, so I'll just give you this here.
Yeah,
It'll take
cool.
a couple of minutes. Here's a pen.
Yeah, I'll get that done
just
now
here
then.
for any, just here for any questions, or you know, I'm happy to help.
Yeah, cool, thanks heaps, man. Yeah, well, I'll get doing that now.
Yeah, cool. Alright, man, so I've just got back your health screening tool here, and you've essentially aced it. There was no problems through stage 1, so we don't really have to worry about any consultation from, you know, any allied health professionals. You've gone through stage 2 with a 0 risk factor, so you're completely good, you're good to go. Now I'll just get a little bit more of an idea here. I see you've got some exercise written here. You're doing a little bit of exercise. What are you doing at the moment?
Yeah, I'm just, you know, I go for jogs sometimes, like, do a bit of skating and stuff.
Okay, yeah, cool, man. And have you done any exercise, any sort of fitness-related things in the past?
No, just like a little bit of footy in high school, like, not like a whole lot, and I haven't really been doing much, you know, since high school.
Yeah, cool, man. We'll move into some of the bigger stuff. What were you looking to get from your training? I mean, are there any likes and dislikes, fitness-wise, and moreover, what are your greater goals? What are you looking to achieve with training?
Yeah, like, I'm just wanting to lean up a little bit.
Yep.
Get a bit stronger. Like, I think getting into some strength training would be a bit of fun.
Yep.
You know.
Yep, that sounds great, man. Yeah, those are all cool things, and that's really good that you're just here and you're into fitness, because you know there's so many benefits of being healthy and training. You know, increased life expectancy, as you probably know, boosts in muscle mass and decrease in body fat. You got a reduction of stress, anxiety. You know, there's so much to it, and with those sort of goals, you know, you should have no problem.
Yeah.
And what sort of value do you put on your training in terms of time allocation? What sort of frequency, or how long are you looking to train for?
Yeah, look, man, I'm really wanting to get into it. Like, maybe do like 4 to 5 sessions a week, and you know, like an hour per session or something like that.
Okay, yeah, cool, man. All right, yeah, that's great. It's really good when we have somebody that puts, you know, values the training and gives us a bit of time, because it means we can really work towards those goals, get some great progression, you know, in good time.
Yeah.
Okay, man. And is there anything that you didn't cover here on the screening in terms of medical conditions? Is there anything else we want to be aware of?
No, definitely not. Like, don't have any like medical conditions. I'm not on any medication or anything like that. So that all that should be pretty good.
Okay, yeah, great, man. Yeah, no medication. That's fantastic. All right, we'll move on to lifestyle. Some of the bigger stuff. You know, I see here that you've got in the screening that you don't smoke. How about drinking? How's your sleep? Your diet? A little bit of information about that would really help, man.
Yeah, like I don't drink really. My sleeping's, you know, just average, just the normal sort of setup.
Yep. Okay.
And yeah, like I try to just eat like as much as I like sort of can, like that's paleo, sort of just start this paleo diet. So
right.
yeah, I'm hoping that'll go well with my training and stuff. Hopefully.
Okay. Yeah. That's probably quite a good diet to pair with the increase in training. So yeah, that's fantastic, man.
Okay. Cool. Yeah.
All right. All right, Cash. So as part of your fitness appraisal, what we're going to do is we're going to measure your height. Okay, so you're up against the wall here. You've got no shoes on. What we're going to do is we've got to find the Frankfurt plane, which is actually this part of your ear. And we've got to line that up with the lowest orbit of your eye here. So I'm going to use a pen, hold that horizontal, and I'll line this up. That's good, man. Possibly chin down just a little bit. Yeah, that there. Hold that position there. And what that'll help us do is we'll get the crown in the right position, which is the highest part of your body. Okay? Yeah, that's good. That's it there. That's it. Yeah. Yeah. Alright, man. Okay. Sweet, man. That's your height. I'll just record this. Cool. Okay. Alright, Kesh. So what we're going to do now is we're going to just get your weight. We've got some digital scales here. Okay, so all we've got to do here is just put a bit of weight on it here to engage the scale. Okay, now just hop on. And it's important just to look forward, to keep your centre of balance right. Okay, exactly 72. I'll just record that.
Can I jump down?
Yeah, you can hop off it. Cool. Okay. Alright, Kesh. Now what we're going to do is take some girths, okay?
Yep.
And they'll help us track your progress, things like that. Okay, so what we'll do here is we'll start with the relaxed arm girth.
Yep.
So is it okay if you can roll your sleeve up here?
Absolutely. Yep.
Okay. Yeah, that'll be excellent. That's it, man. Actually, can you maybe just hold it back? Yeah, because we need to get in here. Is it alright if I touch you here?
Yeah.
Okay, cool. So I'm going to start here. That's the spot, and I'll just mark it here.
Yeah.
Okay. Now if you can turn your arm just a little bit here. We'll find this one here. So we've got the dot on your acromion process. And now, what I'll do is I'll find the midpoint between these two. Okay. Okay. And now we'll get the girth.
Yep.
Okay. So we can just bring this arm out just a little bit here. Okay. Cool, man. I'll just record that.
Yeah.
Alright, Kesh. So now we've done your right arm. What we'll do is we'll just do your left arm.
Yeah.
I'll just touch you here, find the spot. The acromion process.
Yep.
Okay. Find here. Spot if you can just. Let's see it. That's it here.
Yep.
Okay. Okay. The midpoint here. Alright.
Yep.
Just bring your arm out a little bit. Okay. Yep. Cool, man.
Yep.
Okay, so that's your left arm as well.
Cool.
Okay, Kesh. So what we're going to do now is we're going to move on to your chest girth. Alright, so it helps me a lot. You get the best measurements with the most minimal clothing.
Yeah.
So I'm going to have to come behind you here.
Yeah. So you want me to take my t-shirt off then?
Yeah, that would be
Yeah.
excellent. Yeah.
Alright, I'll do that now.
Yeah. That way we can really get, an optimal reading,
Yeah.
an optimal measurement.
Yeah.
Okay, man, so I'm going to come behind you here.
Yep.
Alright. What I'll do is I'll just pass this thing around,
Yep.
around your body. If you can have that thing, you can have this measure up around your chest.
Yeah.
Okay, sorry, it's just folded here.
No. That's cool.
Oh, wait.
Ah, sorry. Yeah.
I'll just grab it from underneath.
Yep.
Okay. Is that in the right spot at the front there?
Yep.
Okay. Okay, so what we're going to do is you're going to breathe in when you're ready with a max inhale.
Yeah.
And then hold, and I'll take that measurement.
Yeah.
Okay, and then you're gonna breathe out as much as you can.
Yeah.
And hold, and I'll take that measurement as well.
All
Okay.
right.
So when you're ready, you can breathe in. Okay. When you're ready, breathe out. Okay, man. Cool. I'll just grab this.
Yep.
And I'll write those down.
Yep. Sounds good.
All right, man.
Cool.
Okay, Kesh.
Yep.
Now we'll move on to your waist girth. All right. So the same thing. I'm going to come behind you here.
Yep.
Just more comfortable.
Yep.
I'm gonna pass it around you here again.
Yep.
Okay. If you can pass that to me, that'll help.
Yep.
Okay. Make sure it's. Now I just gotta make sure it's in the right spot, which it is here.
Yep.
Okay. Oh man, I'm just gonna grab this.
Yep.
And I'll record that.
Sounds good.
Okay, Kesh. What we're going to do now is move on to your hip girth.
Yeah.
It's called a hip girth, but it's probably more accurately called a buttocks girth.
Yeah.
Okay, because that's what we're doing. So, similar thing. What I'll do is I'll just get you to stand on the side here.
Yeah.
Okay. Yeah, possibly even maybe this way a little bit. Yep. So
Yeah.
so we can see everything. Okay. What I need to do, yeah, that's it. I need you to pull your pants tight so I can really see where I'm measuring.
Yeah.
Okay. If you can just loosen up this hand, I'll get this tape around. You can
Alright.
pass it around.
Yep. That's it. Tape around that.
Yep, no worries, yeah. Okay, just 1 sec if I can just make sure it's horizontal. Okay, now can you pull those pants tight?
Yeah.
That's it there. Yep, that's it, man. Okay.
Cool.
Nice. If you could you just hold on to that for a sec.
Yep.
And I'll just record that.
Yep.
Okay, Kesh. Now what we're going to do is we're going to get the thigh girth.
Yep.
Alright, so if you could just pop your foot up on here.
Alrighty. Just like this.
Yep, just like that. That's great, actually.
Yeah.
Okay, and we're going to be measuring here your thigh. If you just want to pull your shorts up,
Alright.
yeah, just pull them up as much as you're comfortable with.
Yeah.
Right out of the way would be the most desirable, whatever you're
Yeah.
comfortable with. Yep, that's great. Okay, so what we're going to do now, I've just got to mark up the points to find the midpoint of your thigh, and then we'll
Yeah.
get the girth from there. Okay, so if I can just pass you this,
Yep.
and you just put that here in the fold here,
Round right here.
where your leg meets
Okay,
your torso.
yeah, yeah.
That's it. It's called the inguinal fold.
Yeah.
Okay, so hold that there.
Mhm.
I've just got to measure here. Just touch your knee here. Measure the top of your patella.
Yeah.
Right. Okay. Now just find the midpoint.
Right there.
Yep. Okay.
Yep.
You can let go of that, and I'll just grab that.
Yep.
Okay. Now, just bring this around you. Bring this around.
Yeah.
Just make sure. Just got to make sure this is vertical, perpendicular to the thigh.
Yep.
Okay. All right, man. Cool. Yeah, you can let go of that, and I'll just record this.
Sounds good. Yeah.
Okay, Kesh. So we got the thigh girth of your right leg.
Yeah.
Now we're going to move on to your left here.
Yeah.
If I can just pass you this again. Put that in the inguinal fold.
Inguinal fold.
Yep, inguinal fold. It's the groove here between your leg and your torso.
Yeah.
Okay, I'm just going to mark out here, sorry, the high point on your patella. Yep.
Yep.
Okay. So we should have a... Yeah. Should be about here. Okay.
Yep.
Alright, you can pass me that. Yep, and I'll just wrap this around here vertically. Should be perpendicular.
Yeah.
Okay. Yep. Alright. I'll just record that. Alright, man. Okay, just the one more to go.
Cool.
Last girth here. We're going to measure your calf girth.
Yeah.
Right, so same thing. If you can just have your foot up on here,
Alrighty.
we'll get that knee at 90 degrees.
Yep.
Just like that. Yep, that's right. Yep, and just have your foot relaxed, you know, so your calf isn't contracted. Okay,
Yeah.
so we just get the
Alrighty.
girth, the relaxed calf girth. Okay, so what I'm going to do is I'm going to take a couple measurements until I can find the largest point. Okay,
Yeah.
so we'll start here. Okay, there's one. Okay, so we're starting to go down a bit, so we'll just come up. Alright. That one there is the peak there of the calf.
Cool.
I'll just record that.
Yep. And should we go for the left as well?
Yeah, okay.
Alrighty.
We'll do the other leg. Okay. Let us come in here if that's alright.
Yeah.
And same thing. Moving down. Okay, we've obviously gone down.
Yeah.
So say somewhere about here. Right. Yep. Okay, I'll just write that down as well.
Alrighty.
For your left leg. Okay, man. So that's it. We've got all of the girths.
Yeah.
And now what we can do is we can go ahead and move on to some fitness testing.
Alrighty. Sounds good.
Okay.
Yeah. Excellent.
What we're going to do now is just measure your blood pressure. Okay, so we've got your right arm here. It's nice and relaxed, yeah?
Yeah.
Yep, your sleeve's rolled up, it's not affecting the cuff.
No.
That's great. Okay, just got to make sure this cuff is just about an inch, 2.5 centimeters above the crease of your elbow here.
Yeah.
That's fine there. Okay, so we've got a little automated blood pressure reader here, which is excellent.
Yeah.
Okay, man, so just relax, and here we go. This cuff will inflate. Okay. Just get ready to record the reading. As it comes down. Okay. Alright, man. So we've got a readout here of your systolic blood pressure and your diastolic blood pressure. So yeah, that's great, man. And I'll just look at that, and this will all factor into the fitness appraisal, and we can have a chat about the results.
Yeah.
And then, so what we'll do now is we'll move on to some more fitness appraisals.
Yeah.
Okay.
Cool. Thank you.
Okay, Kesh. Now we're down in the gym. We'll continue the fitness appraisal by doing a quick 7-stage sit-up test.
Yeah.
Okay? So if you can just hop down on the ground there.
Yep.
Down on the platform. Okay, so what we want is if you can lie back now, keeping your knees and your feet in the same spot.
Yep.
Okay? If you can bring your knees up just a little bit higher, that's it there. Okay? And so what we want is we want to maintain the same angle with your knees the whole time.
Yep.
And also your feet need to stay on the ground. Okay?
Yep.
Okay, so what we're going to do is we're going to start off, there's going to be 7 stages of the sit-up test. We'll
Yep.
start off basic and we'll progress as you go, okay? So the first one, if you can just have your hands on your thigh. Okay? And now just come up. Like that. Yep.
Yep.
Come up between your chest to the knees there. That's it. Okay, now come down. Okay. Now we want your elbows coming to the knee. Now hands on your thighs, hands on your thighs.
Yep.
And just bring your elbows up to your knee.
Like that?
Yep. Okay. Okay, now for number 3, want your arms crossed over your ribs here, just like this.
Like that?
Just over your ribs, yeah, just down a little bit.
Okay.
Yeah. When this time we want your arms to touch the knee.
Okay.
Yep. Okay. Now we want your arms crossed over your chest. Okay. Okay. How's that feeling?
Yeah.
That's alright. Okay, now, getting a little bit more difficult. We want your arms crossed behind the head. Okay, touching opposing shoulder blades with your hands. That's it.
Yep.
Okay, and what we want is your chest to your knee.
Yep.
Alright, your feet bobbled off the ground there, so if you can come down, we'll give that one another go.
Yep.
Okay. Bring this, yeah, that's it. Bring that angle a little bit. Alright. Okay. We'll allow that. Now, what we want here is the same thing. I'm just going to pass you a 2.5 kilo weight.
Yep.
Okay? And what we want is to hold it in the same position you are now, with it just slightly lower than your head. That's it. That's perfect.
Yep.
Okay? Just that knee position again, that knee angle. Feet in a little bit closer, I believe.
Yep.
Yep. Okay.
Like that.
Heels on the ground. And come up.
Ah, that's me.
Okay, that's it.
Completely me.
Alright, no worries.
Yep.
We'll have one more go at that, as long as
Yeah.
it's comfortable, as long as it's not excessive.
Yeah. All right.
Okay, that's it. No worries. Okay, we'll
Yeah.
stop there then.
Yeah.
Okay. We'll keep. I'll look at that. So we're at 5 at the moment.
Yep.
Okay, man. Well, what we'll do now is you can hop up and we'll move on to another fitness appraisal.
Yeah. Cool.
Give you a hand if you want. Okay, Kesh. Now what we're going to do is we're going to do a fitness test here that will give us an idea of your beats per minute in terms of heart rate, and also we can use it to calculate your VO2 max.
Yeah.
Okay, so it's called the Queen's College Step Test, and if you want, I'll just do a demonstration. What it's going to be is 3 minutes here of stepping up and stepping down. And I'm going to play a metronome at 96 beats per minute,
Yeah.
and that will be the cadence for you to follow in terms of stepping up and stepping down.
Yeah.
So I will play the metronome, but it will be something roughly like this. Up, up, down, down. Up, up, down, down.
Yeah. Okay.
Repeat that, that'll be 3 minutes. We'll have the 3 minute stopwatch going, and immediately upon the completion of the 3 minutes, I'll give you 10 to 15 seconds recovery time,
Yeah.
at which point then I'll be measuring your pulse to calculate the beats per minute.
Yeah.
Okay? We can use that to then get a VO2 max.
All right.
Okay? Okay, so are you ready?
Yep.
Let's put this here. Okay. I'll give you a 5-second countdown when I'm going to start the 3 minutes.
Yeah.
And the metronome, are we ready?
Yep.
Okay, we'll start both of these on 1, on the count of 1. Okay? So 5, 4, 3, 2, 1. That's it, man. third of the way through. Nice work, man. Over halfway. Stay with that cadence. Coming up on the final minute. Nice work, man. Nearly there. 30 seconds to go. You're doing well, man. Ten seconds left here. And time. Okay. What I'll do here, give you 15 seconds to have a breath. If I can use this arm here.
Yep.
Once this thing gets to 15, we'll go. Okay. Alright, man. Okay, so now I've got that.
Yep.
What I can do is I can use an equation to calculate it here. So what I'll do is I'll calculate what I counted here, the beats per minute.
Yep.
Okay. What's that? Okay, man. Alright, so now what we've done is we've calculated your VO2 max, and I'll look at all these results,
Yep.
and I'll be able to come back to you with an accurate assessment of your physical condition and you know, your aerobic capacity
Yeah.
and all of that. Okay, so now what we'll do is we'll move on to another fitness test.
Yep.
Alright, man, nice work. Cool. Okay, Kesh, now we're on the final fitness appraisal, and it's just a sit and reach test. Okay, so you've got no shoes on. You're up against the nice solid concrete there. Okay, so what we're going to want you to do is have your legs completely straight,
Yeah.
contracting your quads as well. If it's alright with you, I'm going to hold your knees down.
Yeah.
That's very important. Okay, and what you're going to do is hands on top of each other,
Yeah.
leaning forward. Okay, and we're going to see how far you can touch to. Okay, in terms of the ruler there. So I'll touch here if that's okay. Hold for 3 seconds at the reach. 3. Come back. Okay. Now what we'll do is you have 2 more attempts. Let's just see if you can better that. So if you want to go again, squeeze your quads. Okay. Now one more.
Yep.
One more, yep. Recontract those quads. You can breathe out when you get to the end. That's it. That was an improvement, man. Okay. Nice, yeah, I'll just record that. That last one was the best one.
Yep.
Grab the pen. Alright, man. All good to go. I'll help you up if you like.
Cool.
All the fitness appraisals done.
Yeah.